Welcome back. Welcome to the show, the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, we are absolutely crazy passionate about healthcare innovation, the adoption of healthcare innovation, and our aim is bringing stories to you, real people within healthcare that are really innovating. And we've got a phenomenal year packed out with high quality interviews, content that we're just so excited about. And if you happen to find this content helpful for you, please subscribe now, wherever you are, subscribe. And I'm very, very delighted to bring on our next guest, David Heenan, who is the principal of co-innovate Ventures. David, welcome to the show.
Hey, thanks, Michael. Always happy to talk to you and happy to be part of this show. You've been doing this for a number of years.
Yeah.
I'm excited to dig in with you and talk about innovation and what's coming down the pipe here.
Yeah, I mean, there's one thing that I've just I want the audience to know about you is you bring such a full spectrum of experiences to being an investor. Would you mind maybe just sharing with the audience a little bit about sort of your background, coming through the ranks, being an entrepreneur, then making that kind of pivot into the investor side? I just think it's fascinating.
Yeah, absolutely. One of those sort of accidental, fortunate timing is everything circumstances. So, out of college, I was a research analyst for a number of three-letter government agencies, the last of which was the CDC, where I was editing a medical research journal. And I just happened to be there the same year that the FDA started certifying digital health apps, started allowing for electronically captured data, real world data to be part of new drug applications. And I was sitting there reading these research manuscripts day in and day out, thinking, man, this is such a archaic, inefficient way to collect data from pencil and paper and losing track of people. And so, almost on a whim, me and a buddy decided to step out and start a company called ACES Health. And ACES was a mobile first platform for the automated subject engagement and real world data capture. So we developed an application that could be customized for a researcher. We enabled the integration with health records in the first kind of slew of interoperability regulations, and then integrated the first set of wearables. And those were or not wearables, just connected sensors. Those were Fitbits, those were your Bluetooth thermometers, and use that as a way to innovate the clinical trial experience. We found a lot of traction with academic research institutes, patient advocacy organizations that were really trying to increase access to these trials. And then what was really interesting to me at the time, we found a lot of traction with people with autism and trials around autism, and also with the other end of the spectrum, the elderly people in dementia, Parkinson's, because the ability to get them into a clinic for a trial was very difficult. And their ability to communicate orally was stymied, yet their ability to interact with digital applications was much better. And so that was sort of our sweet spot. With ACES, we raised just over $4 million of venture capital from strategic and institutional investors. I exited that company in 2018 when I had the fortunate opportunity to be recruited into the American Cancer Society, one of the organizations that I had interacted with as an entrepreneur. And they had decided to start a venture fund, an impact fund, around early stage oncology innovation. And since I had this experience with increasing access to clinical trials, it was a good fit. And so I stepped over there to be a director. We managed $25 million over the next 18 months. One of our investments, our first investment actually, Castle Biosciences, had an IPO just 9 months later. But during that journey, my wife had a baby. And my wife just happened to be born at Cone Health and was raised in Greensboro, where we're headquartered. And so when they decided to open a venture office and one of her high school friends called her, it was just a happy timing and circumstance thing again. And so we made the move, and I've been here at Cone Health for just over a year and a half now, and couldn't be happier because of the unique way we approach innovation. And so I think we'll get to that, but want to hand it back over to our host in case he's got a
Yeah.
different agenda.
No, I was going to say, when it comes to innovation, obviously you have an idea of what innovation is. Can you maybe talk about how that melds with Cohn's view of innovation?
Yeah. So starting from just the highest level, I think it's important whether you're an entrepreneur, an intrapreneur, just a mom and pop, or an investor. Innovation happens everywhere, happens all the time. It's not a set rule so much as a mindset. And so with that in mind, that was sort of what we superimposed onto Cohn Health, that this idea that innovation is happening all throughout the organization, and that it is beholden to that organization to really capture it, to foster it, to accelerate it, and to try to leverage value out of it. And so at Cohn Health, we saw this happening, and we wanted to figure out a way that we could make what really is win-win-win partnerships. Win for us, Cohn, the organization, win for our patients, and win for the entrepreneurs that we're partnering with to innovate, disrupt the standard of care. And so from my experience, from others' experience, we saw that, especially in early stage healthcare, money can only buy so much. It can buy you developers, it can buy you runway. It really can't buy you access in healthcare because of the way the industry is. It's very networked, it's very risk adverse. And so you really need an inside out approach. And so Cohn Health wanted to embed entrepreneurialism inside, so that when we came in touch and engaged with these innovative ideas, we knew what to do. And so what Cohn believes is that we have this wealth of assets that aren't money. It's our experts. It's the passion of our leaders. It's patient access. It's 16 years of data that we have in our enterprise data warehouse that we can leverage to accelerate AI platforms or to give marketing insights to other companies. And that this is what startups are really after. This is what they raise money to get to, actually. And so we could cut out the middleman. We could plug them directly into these assets, these transformative opportunities. And in doing so and leveraging those, we asked to be able to share in that enterprise value. And unlike an investment where we put cash down on the table and we say, give us the equity, we say, hey, entrepreneur, this is what you want to do. This is what we want to do. If we can align these visions, we would like to go there with you. And if we get there, meaning if we do what we say we're going to do based on milestones or revenue, we'd like to share in that upside. And so Cohn Health, through Cohn Health Ventures, my office, we invest our non-tangible assets, again, those experts, that patient access, that sandbox, that data, in order to accelerate companies. And should that acceleration translate into regulatory approvals or real revenue, based on that, Cohn Health earns enterprise value in these companies through equity warrants or other means. And in doing so, we really align our team, that is the clinical leaders, the operational leaders, with the management team, the founders of these startups, to do the same thing, to have the same mission. And we have found now 13 times over that this has been a successful formula, actually.
What is it about innovating from the inside out that allows it to work better? Because, as entrepreneurs, as people are captivated by the healthcare space, there's many outsiders that are coming in. So there's innovation that's out wanting to come in. What do you think are those biggest blockers for that not being able to happen? And when we talk about access, which is something that is very near and dear to me, and then we've also had in a previous webcast with Dr. Dennis Humphrey, who spoke about the aspect of leadership and access and how that works. I mean, what do you think have been some of the biggest blockers? And then kind of talk about how attractive it is of what you guys are providing and what you're offering.
Sure. There's blockers, and then there's also kind of dark spots. So I want to start with the dark spots, because the outsiders coming in is exactly what healthcare needs. But it also leads to this other problem, that there's a whole bunch of solutions searching for a problem. And that has to do with not having access to kind of and this is a problem with our health system, I'll be the first, our health industry, I should say. There's a curtain, there's a little bit of a black box about how healthcare is actually delivered behind closed doors that the patient doesn't see. And it's not, I don't think, a nefarious thing. I don't think it's out of deceit. It's just a very complicated industry that America has developed here, where the provider of a good and the consumer of the good aren't the financer or the collector of the payment for the good. And so understanding that is where I think part of the root of the problem is. So one of the blockers is you have an experience as a patient, as an outsider, as a caregiver, and you believe that you know how to fix that. And so you create a solution, not understanding the depth of the problem. And therefore, it ends up being a point solution or something that can't be integrated into the actual work of the providers and doctors. And so I want to call that workflow integration as one of the first blockers. Not understanding exactly all the buttons a nurse has to push, all the calls a doctor has to make to go from point A to point B. And therefore, your directions don't line up with where they actually have to maneuver the car. The second blocker I want to say is the risk aspect. So healthcare is very risky for a lot of reasons. One, it's life and death. People's lives are on the line. So it makes it hard to be experimental, very, very controlled. Healthcare is also risky because as we've developed digital health and electronic health records, now all this very personal, very valuable information is online. And so there's a cybersecurity risk that's very real and is a huge blocker in this as well. And then finally, I think it is what you just said, that there needs to be leadership on the inside. So anytime a startup is going to sell to a clinical or operational leader, you aren't just disrupting the problem you're solving. But what you have to understand is these people have full-time jobs caring for patients, and integrating new software or trying to do something new is really an extracurricular activity. And so there's a lack of bandwidth amongst decision makers in health systems to actually carry something forward. And I think we at Cone Health Ventures are a dedicated team to solve all those problems, actually. So one, we see a problem first. We start internally understanding our operational leaders and clinical leaders' problems. And then we go and find out where those solutions are, rather than seeing a cool, hot, trendy solution and trying to push it into a problem. Second, oh, go ahead. I'm sorry.
I was thinking, can you talk about problems? I mean, how do you prioritize problems? What's the ranking system? Because obviously you can't solve all of them, and you have to kind of prioritize. Do you mind maybe talking about how you guys go about prioritizing? And are there certain themes of problems? Where does it span?
That is actually the toughest part of the job, actually, because there is no shortage of problems. And so thinking about, what we want to solve, or it's really not what we want to solve, it's more what we can solve and what we can solve today, right? And so, one of the first things, and I think this ties in perfectly to what I just said, is we have to have an internal champion that's willing to dedicate some time, some amount of resource to it. Otherwise, we're just going to be beating our head against a brick wall for a long time. So that's really step one. We could have the greatest innovation ever seen to man, but if we can't get somebody to dedicate a portion of their day to helping us bring that in, it's not that it's a bad company or a bad product. It's just, it's not going to go anywhere. Maybe it's the wrong time. Maybe we're just not the right place. So that's the first thing. The second thing is we do run an analysis on every single partner before we make them an offer. And in this respect, we're definitely double bottom line. So the first thing we do is, what's the clinical impact? Are we going to save lives? Are we going to reduce hospital stays? Are we going to mitigate some sort of risk? And if the answer is yes, then we move on to the next phase. And the next phase is calculating the ROI. And in healthcare, you need to understand that there is blue dollars and green dollars. Green dollars, new revenue in. Blue dollars are money saved. Blue dollars are a lot harder to articulate. You need much more complex models and a lot more data. Green dollars are pretty simple: new revenue, new patients. And so we do that ROI calculation to see if it's going to be a significant return on investment to get the attention and the resources needed to implement it. So those are the first two phases. And then the third phase is prioritization through the partner we're working with. How amenable are they to a true partnership? Are they just trying to sell us something, or are they truly trying to co-develop to a solution with us? And so we go through those three kind of thresholds or gates before we decide who we're going to work with. I think right now our themes in the context of the pandemic, honestly, are access, and access has changed to really meaning a lot of digital remote patient monitoring solutions. Mental health has now become a huge focus of ours, and not just for our patients, but also for our employees. So that's a huge focus this year. And then finally, we are looking at ways to expand sort of the reach of our hospital network into rural communities, so people have to travel less, it costs them less. And so this kind of loops into social determinants of health as well as telemedicine, because they're kind of all interrelated. But in that vein, we're looking at mobility, hospital at home, urgent care at home type of innovations. And then, of course, the ever-present data, big data analytics, AI, cybersecurity. If you got something hot, cool, innovative in that area, I want to hear about it all the time.
That's really helpful to kind of know, sort of the common themes. And, I mean, when you talk about leadership internally and you talk about having that internal champion, one is a dangerous number. Are you oftentimes going after multiple stakeholders that you feel can drive it forward, or is this something that, how quick can we actually get traction on this kind of a thing?
Yeah. I think you said it perfectly. One is a dangerous number. More importantly, one is an unsuccessful number, in my opinion. So we do need that key leader that is willing to commit budget, right? And that budget could either be labor hours of people necessary to carry something through, or actual dollars to pay for something. And that's the first step. But immediately, we ask that leader, okay, you want this. Who else needs to say yes? And how do we enroll them in not just understanding what we're trying to solve here, but believing in the purpose? And so we leverage the one champion to go and correlate 3 or 4. And typically, and I want to be clear, I mean, every health system is different. And so I only have the experience I have with mine. Typically, we'll have an operational leader that is clinical in nature. So they are a doctor that also oversees the cardiovascular or the women's health line. And they're the ones on the front line that says, okay, there's a gap in treatment here, or we're losing money here, and we need to solve it. And then we'll have to get them to go enroll finance, legal, and then IT. And IT is a blocker, but it's one of the blockers that I don't want to speak too harshly of, although, we do butt heads, because everybody will say IT sucks. But let me tell you, risk actually bites. And so understanding why they are the way they are is important, but also enrolling them last is important too, because if you bring your clinical leader, your financial and your legal leader to the table, they understand the importance of what you're trying to do, and you'll get more buy-in there. And so typically you're looking at a team of champions of either 3 or 4 to really get some pace on adoption of new technologies.
Look, we're coming into some very unprecedented waters, and the actual adoption of innovation within healthcare, I think, has never been at a higher point. And my hope is that it continues on this threshold. What have been some real high points, some successes that you can highlight throughout, this pandemic that you guys have not only incorporated, but also seen some double, triple threat wins?
Yeah. Yeah, so this is sort of a fine line to walk here, because obviously the pandemic has been a tragedy for a lot of people, a hardship for even more, and so I don't want to underscore that, and I don't want to make light of it, but there is a silver lining here, and I think we have to note it, that this has accelerated and elevated sort of the ire for acknowledging that digital health isn't this fringe thing. It isn't something we do for the millennial generation. It's actually going to be the main way we deliver care. And two, it has put a spotlight on the tremendous, and again, I have to use the word tragic, gaps in our healthcare system for some of those too. And I think those two things have accelerated innovation in a way that has thrilled me to no end. And some of the successes here has been our ability to extend services. And so, one of the partners I'm most proud of in our portfolio is a company called Baby Scripts. They're backed by a lot of big names, including Royal Philips as one of their big strategic investors, as well as Miami Children's. And due to the pandemic, we've been able to start a new program where we offer their services sort of free of Cone Health affiliation. So instead of saying, okay, patients that come here, you're going to get this digital health app for expecting and new mothers that provide education, a lot of the doctors, we have been able to give that to the community at large, regardless of who their provider is, in order to make sure that everybody's getting care, the right care. Because something that's come about is acknowledging that, whether or not Cone is responsible for delivering this baby today, at some point down the road, because of a community aspect of our care, we're going to be responsible for the outcomes of that baby down the road. And so it is beholden to us to provide the best and most resources we can give them now. Second, I've been really proud about the adoption for these new delivery modes of some of our most, let me say, traditional physicians, and how they've readily sort of come to terms with the new age when they were very resistant before, to the point where we have a now robust hospital at home system where we're caring for over 200 patients that would be in the hospital or even in the ICU, that are allowed to do this now at their home, are able to do it. And not only is that safer for them, it's cheaper for them, and it's cheaper for us, and it's safer for everybody else as well. We've also been able to extend other programs out to the community, as well as food as medicine actually is one that we grew significantly under this new pandemic, as well as transportation services for our patients as well. So there's some of the bright spots that are coming out of this. I'd like to name Baby Scripts, Proficient Health, KP and Advisors as some of our partners that have really stepped up and at times provided free solutions in order to meet the needs of a pandemic right now.
It's amazing. You spoke about it before, about this idea of access, and if a healthcare entrepreneur is out there, they want access to be able to get feedback on their product and continue to iterate. At its core, at a human level, you talk about access to food, access to care. I mean, these are things that people need in order to be able to thrive. And the fact that you guys are, the fact that the organization is putting that first and providing this care outside of the walls, not knowing whether or not if they're going to immediately reap the benefits of that is really, it's really nice to hear that.
Let me give a quick plug for my home team here, Cone Health. Unlike the vast majority of healthcare today, Cone derives nearly 60% of our revenue from value-based care. And so that puts us in a position to really understand the benefits of those programs you just mentioned. Because of that, we know that we're going to, some point down the road, reap the benefits financially as well as clinically for that. So I'm pretty proud of the organization as a whole for being in this position, which I think has helped them succeed more than most in these circumstances. In this age where we've seen a lot of big brand name hospitals lay off lots of people recently, we've actually been on the other side of that coin, where we're seeing our business grow because of our early embrace of value-based, risk-based care.
Yeah, that's something that I think you're going to continue to see in terms of people moving over into that sandbox. And it sounds like because you've really made the intentional effort of shifting over there, obviously with good leadership, that it's starting to really take shape on multiple levels. We have a variety of folks that listen into this webcast, and I would just kind of, before we sort of sign off, is say, well, to the healthcare entrepreneur who's really trying to gain access, what's one bit of advice, one golden nugget that you can provide, that entrepreneur that's really trying to change and shift things around?
Yeah, so I think for all entrepreneurs, customer discovery is obviously key. I think this is especially relevant in healthcare. Before you go to sell, before you even go to create, I think you have to do extra diligence and understand it. And what's beautiful about healthcare, I would say the vast majority of these leaders don't do it for the money. They do it because they believe it, and because it gives them meaning. And so if you approach them from an aspect of wanting to understand in order to make healthcare better, that is something that will resonate with these champions. And getting a mentor or an advisor on the inside early on through that tact, before you go and sell, before you go and start writing code, I think is very pivotal. Is trying to get the access early on, I guess, is what I would say. And second, and this is self-serving, but I'm going to do it anyways. Outfits like mine, I think, fill a very nice gap in the market. If you believe that you have an important innovation, you have some traction or no traction, you can reach out to me. I'm on LinkedIn, David Heenan. I'm sure Michael will tag me when he posts this. You can also go to prinnovo.com, PRINNOVO.com, and find me there. We will, even if we're not your partner and it doesn't get to that stage, we'll give you the advice, we'll give you the insights that we can as we talk to you. But we'd like to hear from you, because looking at these accelerators, and we're not the only ones. I mean, Cedars-Sinai has a good one, Mayo Clinic, MD Anderson. Looking at those programs and getting into those programs so you can innovate from the inside out too is very important. And so my advice is if you want to disrupt healthcare, start engaging with insiders as early as possible. And that way you can avoid delays, mistakes, but also gain an understanding that you can't have unless you're in the trenches. And it's sad, and I don't think it should be this way. But the truth is, our healthcare industry is very complicated, nuanced, and esoteric, for lack of a better word. And so ask for help. Excuse me.
Yeah, asking for help. You never know what you might get from there. David, this has been an absolute pleasure. I think you've not only underpromised, you've over-delivered in terms of the value today. So incredibly grateful for you being able to spend some time with us. And for those in the audience, if you found this content helpful, would you mind sharing it on social media? Would you mind commenting on it? Would you mind even just liking it? It would really make a world of a difference to us, especially when it comes to wanting to advance healthcare forward and bringing more innovators, more doers, into our community is always
and
going to
I'll
be
also
helpful.
give you a plug, Michael, because when I was an entrepreneur, we talked a bunch and you gave me some good insights and some good introductions. And now that I'm on the other side of the table, you've also been able to bring some good companies forward and get them a good look at innovating within Cone as well. And so it's not just our outfit, guys, it's also people like Michael out there that are there to help entrepreneurs as well.
Yeah, I think at the end of the day, people want to deal with real people, and they'd rather deal
Amen.
with a leader that's real than a leader that, tries to be right all the time. And I'd rather be a real person, and I'm glad that you're a real person too. So I've enjoyed the discussion, and I'm looking forward to our next one.
Thanks,
Take
Michael.
care.